Today I'm going to present on forensic medicine. Forensic medicine is, I think, is not well known in our country, and dentists have not been practicing, I think. So it was just suggested by the members of the committee, so I just took some of the members, so I just, because I had the material, so I decided to present it, and I hope you will find it enjoyable. And as you know, I just took first the general forensic medicine, and I will just discuss what forensic medicine is, and next what's forensic medicine in general. And the presentation is just an overviewing subject material. So forensic medicine is a branch of medicine dealing with the application of medical knowledge to establish facts in civil or criminal legal cases, or such as an investigation into the causes and time of suspicious deaths. Also, it's known as pathological medicine. So, in fact, it is in abroad, it's a pathological medicine, and when it comes to the criminal condition, it comes to be the forensic medicine. And in our country, I don't know, in general medicine, there is a forensic medicine, but in dentistry, it's not being practiced. So this is to give you an overview on forensic medicine, and I will go to our topic, that's dental forensic, and this is valuable expertise that's called forensic dentist. And dentists trained in forensic are skilled at identifying victims of homicide or disaster, such as a plane crash, or explosion. And today they can establish positive identifications, sometimes in a matter of minutes, with sophisticated computer identification. It's not in our, I'm just talking is about advanced countries. So what's dentistry's involvement in forensic medicine? What can the dentist do, a trained dentist in forensic? So forensic medicine is a science that deals with a relation and application of medical facts in legal problems. So dentists who work in forensic now can establish a positive identification of human remains. Human remains means when a patient dies or is criminally and is not able to identify, so it's believed in the world even the best person to identify is the dentist. And how we will just discuss it. How is the technology changing the day, the way dentists can help identify the remains of crime victims and missing persons. Like sometimes the person may die due to crime or may be missing and people cannot find him. So where no dental x-rays are available, digital photographs taken of the teeth can be used to compare a smiling photograph taken during the victim's of life. The most thing that's in our conditions that we should give attention, and why I brought this for a presentation, is it's important that we should have the records of a patient before, while he's alive, so that it will be contributable to these conditions. Keeping in mind that we need the record, and one of our deficits in our practice, I feel, is we don't keep records properly. If in advanced countries everything is recorded and all the teeth are counted and the missed is well recorded and the restored is well recorded and the prosthetics are also well recorded. So we have to learn to practice this in our daily practice. So if it is so, then this is also important that we need to go with the advancement. So we have to participate in all activities that are carried out in medical field. So, and we should also think, as if you remember in the morning speech, that we should modernize. We should make the dentistry modernize, and we should be active to participate in all activities. So what is the main goal? What is the main goal of the forensic dentist that's trained in forensic medicine? So the main thing is to quickly identify the deceased or the lost. So quick identification. Then in US, in fact, the dentists have helped the people to identify the, the criminals. They have helped them to help the criminals. And in US, they have planned to do what? Conduct research to develop a nationwide high-speed dental identification systems that can compare thousands of dental records in minutes and automatically rank possible materials. So possible match. That's how do I identify? First, as I told you, record should be well recorded, and then later we have to compare. So what is expected from the dentist is to keep a well kept record. Then the arrangement of the teeth, each person teeth is not the same as you know. The arrangement of all of our teeth in the jaws, upper and lower, are not the same, and the occlusion is not the same, and as orthodontists know it very well. So they are each and everybody, the face is made out of our jaws and bones of the face, and they are not the same. It's because of the natural differences in the arrangements of the teeth on the jaws that makes the difference. So we have unique difference. So, and almost all of the US have had some kind of dental treatment, or else the other chances that maybe one of them has a dental treatment, maybe is extracted or restored with amalgam or any material which Dr. Makono was discussing, or maybe is lost and replaced. And where dental records are available, it's possible to study a set of teeth and compare the teeth with dental records, which I just mentioned before. If we have already existing records, then it's not going to be difficult to identify. That's to compare if the person resembles the previous record. And this comparison allows dentists to establish the identity of the body, just like fingerprints of DNA evidence. That's in general medicine, they use the DNA, fingerprints, and footprints, and other means. And in the dentist, if it is well recorded, it's almost the same as that type of identification means. And as long as this trend of murder and criminal is there, then dentists who work in forensic can play a critical role in helping identify victims. So if we have that, then we have to also have the forensic dentist. So in the way, I'm inviting the dentists to have a training and get ready for modernizing our profession. So provides us the necessary information are there. So if the forensic dentist is trained, then he is going to alarm our daily practice to keep records so that he can properly work or make his or her work effective. Then as a dentist, every professional has a responsibility to keep it. What's all necessary responsibility of all dentists or all practitioners. So this is just important that we need to keep in mind, that we have to keep the records. So what are the principles of dental identification? How do we identify? Identification of the deceased is an important standard of civilized society, and dental means are accurate and reliable to ensure a proper identification. In developed countries, it is believed that dental identification is proper and reliable. And by using a methods, what are the methods used? Methodical preliminary evaluation and post-mortem examination, ante-mortem investigation, and comparison. Also, there are some questions regarding the way in which the conclusion is developed. Dental identification has long been regarded as reliable and accurate. So even though there are some difficulties, as I told you, maybe it's not well recorded, or maybe it's in advanced countries, things are changing, that the challenges are coming, that the patients, in fact, the regime is changing in previous times. If you remember, dentistry in abroad and dentistry in underdeveloped countries was different. In developing countries, it was raising, and in developing countries, it was very low. And even in our country, as you know, it was given a very low attention because of the low rate of dental caries. But now it's changing, that in advanced countries the care and the attention is high and the prevalence is low, but in our situation the food style is changing and the dental care style is raising, so it makes it easy to identify. But in advanced countries, it's maybe is difficult because the treatments are changing. They are not taking treatment because they are keeping their oral health very well, and there is no treatment to be carried. So that may make it challenge than otherwise. If the information are there, there is no problem to identify patient. The most common role of the forensic dentist is identification of diseased individuals, as I first tried to discuss it. Comparative dental identification is to establish to a high degree of certainty that the remains of a descendant and a person represented by antemortem dental records are the same individual. That's what I previously said. After he collected the post-mortem examination, and then the next will be comparing with the antemortem examination. Then decide whether they are the same or not. Then, in case where no antemortem information is available, a post-mortem dental profile is completed by the forensic dentist from studies of the teeth, jaws, and related facial structures. And investigators can narrow the reach for the post-mortem records to a specific population pool. That's they will be in a limit if it's a difficulty. In fact, if it is not there before the antemortem examination is not well recorded, it may challenge, but it will just specify to some extent that the examination will be done, and then their reliability will be focused. And important clues in resolving the case are available if antemortem data can be obtained for comparison with the post-mortem findings. So reliability is confirmed if there are antemortem examinations. So the resilience of teeth and their supporting tissues to be perio and post-mortem assaults provide wealth of information for those interested in the identity of the disease. So the periodontal condition, the teeth number, the teeth alignment, all structures in the oral cavity are important to identify the deceased. And the conditions may be chemical attack, burning, burial. So the person may die of all these conditions, and even so burning and burial and submersion, all this that this will not be affected. And if you know from the anthropology, a person teeth are there always in their place. So, and even a severe head and neck trauma are all withstood by the dentition to an extent where identification is possible. So it's all, we know it from the history and anthropology, that what are the failures to identify the disease using the dental forensic medicine. So the lack of a tentative identification or failure to locate dental or similar antemortem records is a more common reason for an odontologic investigation to fail. So if we don't have the proper antemortem records and informations, maybe it will lose its reliability. But provided that all records are there, antemortem records are there, then it's very accurate and reliable, is believed to be accurate and reliable in advanced countries. So human dental age estimation, for example, is using third molar developmental stages, and accuracy of age predilection, not using country-specific informations. And unquestionable forensic age investigations are based on statistical models constructed on a sample containing subjects of identical origin as examined individual. So also models used for prosthesis or orthodontic treatment are also helpful in identifying. So in case where the corresponding models are unavailable, the established report has to describe the possible effects of this unrelated information on the predicted age outcome. So these are the most important points. Thank you for listening, and I hope the door is open for discussion, and you can comment on it.
There is infectious and non-infectious disease. That means normally we can classify infectious disease and non-infectious disease, general disease. But you said that dental caries is actually not categorized under infectious disease. But my doubt is here because infectious disease actually the involvement of pathogenic microorganisms. Therefore, in this case, there is an involvement of microorganisms, especially in plaque, to start dental caries. Therefore, I have doubt in this part. Another point here is especially you have said something about pulpitis. Actually, pulpitis is caused by infection, but this can also be occurred by trauma. So, can we say pulpitis is occurred only by infectious disease? This is my question. But in general, I have opinion. As we have seen this presentation, most of the presentations are based on facts, scientific facts. But why we don't give emphasis studies that are found in our context, especially problems that are found in our community. Some studies should be done in our context. Why don't you give emphasis in this area? This is my opinion in general.
Any hands? Okay, thank you.
I think both of them are, I can take them as comments, not questions, because as we said, I said in the beginning, this presentation is not a scientific paper, but it's just a continuing education to show what type of sequence we have to follow to deal the caries cavity, that it should not end up with infection or as infection. What you said, infection of pulp and trauma, they are both infections. The trauma will be infected with microorganisms in the oral cavity or microorganisms on the material which penetrated the pulp, or heat. You know, after heat, for example, when you prepare the tools, heat develops and the pulp dies. That causes infection because of, you know, it will rotten inside. So these are all infections. And as caries, you know, we can call it infectious, but through the development of the caries cavity, when we are just verbally discussing that sequence. Otherwise, by itself, caries is not an infectious disease. We cannot promote easily to another person caries. But the complication of caries is infection, and that is infectious. If a person has got pulpitis, and that person has got, for example, has undergone another operation in the body, microorganisms from the pulpal infection will go through the bloodstream and cause infection of that operation area or the operation field. That's why in developed countries, if a person is not well treated by a dentist, he is not allowed to undergo any type of surgery. This is the cause. So that's the other comment I do have. And about the last comment, I love it. Really, we cannot discuss everything at the time because these are very important. Anatomy is important, and what we lack is anatomy. because in the beginning at school is very difficult, and the teaching staff most of the time it will not repeat anatomy. Otherwise, anatomy is repeated up to the end of your training. And when you go postgraduate studies also, it comes again anatomy, because anatomy must be 1, 2, 3 in our mind. We have to see the patient anatomically, or the tooth. Whatever feeling you do without anatomical understanding of the tooth shape, that feeling is not successful. It will break or it will cause some other problem. Thank you.
Dr. Mokonin, one question. Most of the time in our hospital practice, other clinicians do not consider dental infection as infection. Even they are not giving antibiotics for patients. If we do not consider caries as infection, for those patients who are coming from far apart or who do not get dental service, they are giving anti-pains or non-steroidal anti-inflammatory drugs. And there's a complication, or the infection is becoming worse. As we know that, dental caries is caused by Streptococcus mutans. They are bacterial. So it is better if we consider dental infection as any bacterial cause of infection. Because if we know the etiology, we can treat by chemotherapies. So it is better, and we educate the other clinicians that dental caries is also bacterial infection, and it is also it causes the head and the neck infections. Even in my hospital, dental infection or dental disease is becoming one of the top 10 diseases. So it is becoming very, very prevalent. So it is better if we consider dental caries as dental infection and as a bacterial infection, because the principle to treat bacterial infection is the same for all infections.
I think it's a good comment, and I want to add there is a big problem in Ethiopia, the basic problem. The medical training is ill prepared, not having dentistry in their program. There is in the curriculum, because the curriculum will not be recognized otherwise. Addis Ababa University Black Line Hospital, they have got dentistry in their curriculum, but there is no dental program. The dentists will not teach as required. Sometimes they say there is no one, and so on and so on, but it's negligence and not understanding the dental profession, and they have limitations in their own knowledge. They are not knowledgeable, those people. That's why they didn't involve dentistry, which is a core science for those graduates. And that's the problem. But we have to fight for that. I used to fight, and it was almost approaching. We had some programs with Addis Ababa University, but now again it's up and going. But it's really serious. Dentistry must be. Then they will understand. Every hospital doctor will understand what is dentistry. Is it an easy science or really a difficult science? It's really difficult. It's really a serious science. So they don't know it, and they cannot say, this is infection or this is causing damage and so on and so forth. So this is a matter of time.
Okay, thank you very, very much for your response and your presentation. Now we can proceed to Dr. Banches.
Thank you. In fact, it's a comment, given a comment, so no question. One of the comments was given by, I think, Dr. David. Am I right, Dr. David? No, first. About it should be a research work like that. So we would be very happy to get research works from all members. We have invited almost all members, sending emails and even SMS texts and so on. But what we have got is this, and what we have prepared is this. So just I invite you also to participate in collecting research and presenting and giving for the development of the journal. Thank you for the comment. And the second comment was by Dr. Abenezer. Dr. Abenezer, I think what you have said is a good comment that helps to collect information very well. If we remember the enumeration of dentistry or identification of teeth in the oral cavity, we use FDI means, and that is very easy to use electronic means to keep records. We can easily use the FDI means, that is, we can put numbers before indexing, and then we keep records of the teeth and what happened to that teeth. So it's very easy. It's more comfortable for keeping record. Nothing is bad out of it. In fact, the bad thing is to write in cards and keeping it in the record room, and that's the most difficult that we are facing at this time. So it's a good information that you are giving us. If it is possible to use electronic means in all clinics and hospitals, that would be very easy for the forensic dentist. And this is just the beginning, and we are inviting to try to get training on it. I mean, is to have an interest towards it so that we can make our profession modernized. Thank you.
The topic is challenge of dental practice in Ethiopia. The earlier professionals, you know all what the challenges are. You came across them all. But for us, I brought here just for the solution and recommendations, as I mentioned earlier. As we know all, in the branches of human medicine, dentistry is the only field to run independently, starting from freshman course to different specialization and sub-specialization since long ago, as Doctor of Medicine or DDS. And from then, it is on progress to become more scientific and molecular level of diagnosis and treatment in developed countries. In most developing countries, however, dental practice is yet not improved as expected. So, what are the influential factors, or what is the problem here not to develop or improve as expected, just taking our country, Ethiopia, as a model of developing countries? So, among the factors or the challenging factors here, as they are all mentioned earlier by different professionals in different topics, one of them is prioritization of the government. And the other is unavailability of materials and instruments. And lastly, lack of public awareness. I know there are a number of challenging problems to be mentioned, but in my view, all of them can be included under these three factors. The first, let's see a little bit about prioritization of the government. There are a number of diseases which are more severe and fatal, for which the government gives great concern to facilitate every possible diagnosis and treatment modalities. This is acceptable to some extent, considering capacity, severity, fatality, and prevalence. We agree all on this point. However, total negligence of dental cases can result in serious complications that can bring health and economic crisis of the community. Just to mention one example only, what is happening in here, St. Paul's Hospital. All over the country for maxillofacial surgery, cases come to St. Paul's Hospital. A patient is expected to come about 5 times. Imagine. The first contact will be registration or referral from their resident hospital. Then after appointed for consultation for the maxillofacial surgery, then appointed for biopsy, then for the biopsy result after a month, then after for an operation another time. Imagine the patient is coming from very far, like thousands of kilometers. There are a number of facilities to have here like reservations and everything. Imagine how much this is very challenging problem for the patient, especially for the poor. And in today's status, a number of governmental hospitals are lack of dental professionals or otherwise necessary materials and instruments. We know all them. And at most hospitals having dental professionals, and the practice of dental work is nearly negligible. Some of those hospitals have non-functional dental units, and others have not any dental unit, practicing only extraction on some guest chairs, as you know. Even I know one of my colleagues who was graduated last year or so, working Awasa. Here, this is one of the most known town. There is one hospital, but she is still working only extraction on some guest chairs. Imagine how much the field is neglected. Do you think that this is all about the problem of capacity of the country or the government or negligence? This is to think. I brought this just to think over. The other problem is lack of instruments and materials. With the dynamic change of science and microbial resistance, updating the current treatment and diagnosis modalities are a must for effectiveness of each dental procedure. Nowadays, dental practice in developed countries is at the peak of molecular level for diagnosis and treatment. As we have mentioned earlier, the old dental materials and diagnosing and procedural instruments are continuously replaced by newly advanced and effective one, which is comfortable for both the patient and the practitioner. We now who are working at some governmental hospitals on which type of instruments and units are working. Here in our country, Ethiopia, there are no legal dental materials and instruments wholesalers that have all-inclusive and current. I know there are some, but they are not all-inclusive, and they don't bring all the current materials and instruments. And if they are bringing, they are too expensive and affordable by the newly coming generation. As a result of this, most private dental sectors are exposed to use expensive, non-standardized, and expired black market materials and instruments which are ineffective, time-taking, and uncomfortable for patients and practitioners. This is real. Few governmental hospitals that need to purchase, even if in case, I know some are there are some, but if they want to purchase, they have to get these all materials at some legal wholesalers. For the government, it is really not expected to buy from some black market, so that these all governmental hospitals left helpless with no materials. At the same time, the poor who are unable to afford the private sectors remain helpless. The third challenge will be lack of awareness of the public. The other big challenge here, the community doesn't know which type of dental treatment options are there, and they don't have any habit of treatment seeking regarding dental care. For this, the solution identifying the problem is the primary activity that most patients' knowledge or aptitude of dental treatment options is extraction of tooth only. Whenever they come to hospitals, especially in rural areas, every patient aptitude and knowledge is on the extraction of tooth. This can be supported with some research which was done in 2012 Ethiopian calendar at Capital Hospital, where I was in dental intern at Jimma University. Let me bring you some results from that research. The research's title was Assessment of Patient's Knowledge, Aptitude, and Practice of General Dental Treatment Options. And the assessment of knowledge of treatment options for painful, restorable teeth only 8 or 6.7 patients now in endodontic treatment, whereas 110 or 91.7% patients responded extraction as the only treatment they know. Imagine how much far apart the two figures are. Only 45% patients now feeling as a treatment option for painless habitated teeth. Otherwise, the remaining do not have any information about feeling. Only 22 or 8%, 18.3% patients now orthodontic treatment for malposed or rotated disfiguring of traumatic teeth, while 80 or 66.7% now extraction as the only treatment option for this disfiguring case. 95 of them, the total population was 120. 95 of them, or 79.2% and 88 or 73.3% population now replacement for missed teeth, other than third molars, and scaling for hard disfiguring deposits on teeth respectively. Relatively, more patients now about the replacement and tooth cleaning. They reply that, what do you do if some hard material or hard deposits on your teeth? They say just matter or something. They understand that, and also replacement. This is the figure actually. What is mentioned on physical examination and diagnosis. 143 endodontic cases were identified on the dates of data collection, out of which only 14 or 9.8% treated endodontically. This includes patients who were referred even because of unavailability of treatment modalities there. However, even though only 84 extraction cases were recognized, 97 or 115.5% extraction were done. On the other hand, 2 or 2.4% out of 83 orthodontic cases, or 5 or 4.5% out of 111 prosthodontic cases, and 4 only out of 130 patients having periodontic cases. This is calculated per cases actually. 113 patients with periodontic cases, and 50 out of 42 soft tissue and or bone illnesses were treated. The others all were deferred, or otherwise the patients do not need any treatment. No patient gathered any information on assessment of information about what they know, the treatment options. No patient gathered any information regarding dental treatment options from health education, reading materials, or academic. All patients' information about tooth extraction is from somebody else or exposure during childhood, and relatively large number of patients who now operative and orthodontic treatment gathered information from television. That accounts 33 or 61% and 18 respectively. In the study also, 45 or 43.3% patients with painful restorable teeth have aptitude for endodontic treatment when they are told as what is the treatment, and 89 or 74.2% have aptitude